Welcome back to the Mountain Morning Show. Park City is full of high-performance athletes, but we are lucky to also have high-performance medical professionals. Dr. Max Testa from the Park City Hospital is here in studio, joining me to talk about his high-performance camps that are coming up in 2019 and much more. Thank you for being here.
Thank you. Good morning.
So tell me a little bit about yourself, where you're from, how long you've been in Park City, and what you do.
All right. So I'm from Italy. I grew up on Lake Como, on the border between Italy and Switzerland. And I moved to Park City with my family 12 years ago. And I've been enjoying any minute, any day since we moved here. Professionally, I've been a sport doctor for 35 years. 17 of those years working in Italy, mainly in a performance center, working with all kinds of athletes. Professional athlete, but also patients that were coming back from injuries or coming back from, for example, heart surgery. Matter of fact, my hospital was specialized in cardiac rehab, transplanted patient, and there are a lot of similarity between training a normal person that want to get better coming from a disease or from having risk factors for heart disease, for example, and training professional athletes. I think that everybody should be treated as an individual, understanding their physiological and medical profile, and getting the individualized program that addresses their needs. So the similarities are the same. The last 18 years I've been working in the United States. In the United States, I know sport medicine is more injury driven. So I see a lot of shoulder, knees, spine, these kind of things. And these are things that I enjoy too, but my passion is more performance sport medicine and exercise medicine. So use exercise, training programs to better nutrition to improve physiological performance.
So over at Park City Hospital, tell me what you do exactly, like specifically who you train and how you train them. Yeah,
so in Park City, the Park City Hospital, we're lucky we have a lot of great programs. One of these is the Live Well program, and I participate to the program. Live Well is a program that has the goal to make people live in their healthy possible life. So we emphasize exercise, regular exercise, proper exercise, correct nutrition, stress management, good sleep, because sleep is very important for you as an athlete, but also as a normal person to maintain good health. And so we emphasize a lot what it would be called preventive medicine. Within that umbrella, we have other services, and I run mainly the sport medicine. So I see all kinds of sport-related injury, and also the ones that are not sport-related, knee, shoulder, and so on. And we are developing a performance program that targets all kinds of athletes, from recreational, beginners, people coming back from injuries or illnesses. They want to exercise in a healthy way, accordingly to their current status of health, their potential, and their goals. And so we have a pretty wide range of the population that we like to target. We have some professional athletes, like you said, in Park City we have a lot of those. And so sports science and applied sports science can do a lot to optimize performance. Not everybody necessarily has to train the same way, even for the same sport. And so we try to, our hallmark is individualization. So you come in, we profile you in terms of health, in terms of history of injuries, history of illnesses, and then we discuss with you what would be the best exercise modality and your individual training program.
So if you have an injury or any kind of issue that's sports related, for instance, cardiovascular, if you're having a hard time catching your breath or something just seems a little off, we can call you and you'll take care of us.
Yeah, no, I mean, definitely please do it. That's what we do. If you have symptoms during exercise that make you feel uncomfortable, definitely we could be a first step for you to come. And then if we realize that there is more than what we can manage, we're clearly going to refer you to the cardiologist. We have cardiological services up here with state-of-the-art equipment and programs, and or a pulmonologist or whoever else needs to be involved in your plan of care.
So you're a great place to start, whether you have an injury or you just want to take it to the next level. I like that you will treat professionals as well as just our regular athletes, run-of-the-mill. I think that's a
yes, and that
great
has
thing.
been sometimes is a problem when you talk about sport performance. People think about only top athletes should go there. That is not the case. I would say professional or highly competitive athlete maybe represent 5% of the patient we work with, but the majority are weekend warriors or people that had an injury and want to go back to be in good shape or find a way to exercise that is better for them.
Well, I'm such a fan of the Live Well Center. I like that we have this resource in Park City to help us feel our best regardless of what level we are or where we're at. I've read that you have a very holistic approach to caring for your patients. Can you tell me a little more about that?
Yeah, so in Europe, sport medicine training is a little different. It's a 4-year specialization. You do 2 years of cardiology, you do pulmonology, you do sport science, sport nutrition. So when I see the athlete, I'm kind of the family doctor of the athlete. So I can see them for any illness, like a family doctor, and but also with issues that are more specific. Overtraining, for example, could be one. Fatigue, poor recovery, underperformance. And then, you know, I cannot clearly address all of these issues, but I think that I could be in Europe they say the sport doctor is the quarterback of the athlete. So I'm the one where the athlete come, they have an issue, say, no, I think you should go to see this person. So for us, it's very important to create a network of specialists that have interest in sport and exercise. And we're lucky that within Intermountain, we have a lot of doctors from different specializations that would like to work with performing athlete at any level. So I'm kind of the playmaker or the quarterback of the athletes.
I like that, the quarterback of care. I think that's...
Someone told me that a long time ago, and I like to think about that.
Yeah, that's a great analogy. So how can we get more information about getting appointments with you, seeing you, or seeing anyone in the sports medicine program over at the hospital?
So one way is to go on our webpage and for Live Well, and we have Live Well, as I said, here in Salt Lake. Or you can just call the Live Well Center at the Park City Hospital and just ask about information and if you have a specific question. Probably they're going to pass you to one of the exercise physiologists or the nutritionist, so you can talk with someone. Sometimes I talk to this patient, have a question, and we can give them all the information they need.
Great. Now, you have trained Olympians, world champions. I read Lance Armstrong.
Well, Lance Armstrong at the very beginning of his career,
Really?
when he was still an amateur and he turned pro. I worked with him. This was when I was still living in Italy, and Lance joined the Motorola team. Okay. So early phase of his career, but you know, the first year he joined our team, he won the world championship. So it was a good satisfaction. And I was helping him with training at the time. He was living in my own town. He moved to Como. And yeah, so I worked with him for a couple of years. It was a good experience. And then I was lucky enough that I kept working with some good athletes. Right now, I'm coaching the Olympic champion, Greg Van Avermaet. I've been working with him for 8 years. And it's not unusual in Europe for an MD to be a coach. Most of the coaches of national teams, they are MD, train like me in sport and training and exercise medicine. So here people say, oh, why you're a coach? In Europe, pretty much all the sport doctors are also coaching. You know, it's part of your training science. And so I enjoyed that part because it's a good way to balance that with seeing people sometimes very sick. And as I said, there is a lot in common. You know, you shouldn't treat them that much differently in the concept, the approach in their care.
Oh, that's
so
interesting.
It's a good mix.
So you are in Europe a large amount of time of the year coaching cycling teams, correct?
Yes.
Or being a medical professional on the team?
Yes, so I travel with the team. You know, I go to the Tour de France. I did 25 of those over the last 30 years. And then I go to the team training camps in Europe where we do testing for the athletes and we write their training programs. Sometimes, especially during Tour of Utah, those athletes come here to train in Utah for altitude. It's great terrain, plus the altitude advantage. And we test them at the hospital. They come over and we do their physiological testing, VO2. And it's nice to have these pro athletes up here.
Yeah.
Yeah.
Absolutely. Well, thank you so much, Dr. Testa, for
Thank
joining
you.
us here on Park City Television. This has been a great conversation. I could keep talking to you about all of these things, but we appreciate you taking time out of your busy schedule to
pleasure.
be here.
Thank you.
Thank you so much.
Thank you.
All right, Dr. Max Testa, if you want more information about the sports medicine program, high performance training camps over at Park City Hospital, check out their website or give them a phone call. They are in your corner. They are your playmaker or your quarterback in your care to help you feel your best, whether you're a professional athlete or a weekend warrior. You want to check them out. We have so much more coming up right after this. People's Health Clinic, they are here to talk about healthcare. So you want to tune in right after this quick break.